I am so used to teaching with a mask on that it becomes a little bit difficult to do this without one on. But I think it's the appropriate way to do this. Dr. Wilkinson, esteemed faculty, members of the Doctor of Physical Therapy Cohort 14 students, by the way, you look handsome and beautiful, depending on who you are. Welcome. Welcome to friends and family who will be viewing this from home, from cars, hopefully not while driving or wherever you may be. Welcome to this white coat ceremony for DPT 14. I'm Dr. Paulson. I'm one of the faculty members here, and I've been invited to MC this wonderful event. Tonight, we'll have just a few formal things before we have the opportunity to don your white coats for you and with you. First of all, we'll have Dr. Wilkinson, the director of the program, speak to you and provide opening remarks. Following the program director, we'll have some special remarks by Dr. Rodri Purcell, who was elected to be speaker by you, so we're excited to hear from him. And then student remarks, and that will be provided by Terrence Motley, also an elected speaker representing the students of Cohort 14. We'll go to that point, and then we'll consider providing you with a white coat at that time. Dr. Wilkinson.
Hey, everybody. Hey, I'm gonna hurt myself. Friends and family online, faculty members, and DPT 14s, welcome. This is a great occasion. Dr. Purcell's gonna talk a little bit about the white coat and what it means. It's a tradition throughout most healthcare education programs. What is seldom talked about with the white coat is, besides some of the symbolism of it, we seldom talk about that it's white in the sense of we got to keep this thing clean. Those of you that have kids may understand this maybe more than others, but it's a challenge. And so, part of your responsibility of having a white coat is to keep it clean. So you make your plans, you may make choices to decrease the likelihood of getting it dirty or stained. But unfortunately, even with your best plans, somebody's gonna spill something on it, and that may even be you. So I've been thinking a lot about unplanned events. I don't know why. Maybe it's the past 2 years that we've been living through where almost on a daily basis we have unplanned events. And you guys have been here with me through that entire time. So you understand this well. As much as you may not like thinking about this, you're going to have plenty more of these uncontrolled, unplanned events. And as much as you cannot plan on them, you can be assured that they will happen. I've entitled my remarks today in the form of a question. What is your plan for the unplanned? And maybe we can find the answer in what we do with our patients. And if you think about this idea of unplanned, we could probably all agree that any of us wouldn't be here if not for the unplanned. Our livelihood as PTs are basically based on the unplanned. We have patients who have falls, fractures, burns, strokes, spinal cord injuries, developmental delays, all out of their control, not planned, and not by choice. So these patients end up in our clinics where we might find they have a deficit. And what do? We push them. We ask them to do things that they may not want to do, things that may seem incongruent or insurmountable, and maybe even crazy, like, oh, Mr. Jones, you're weak. Let me give you some weights to lift. Or, Miss Smith, you've just had surgery. Let's go for a walk. Seemingly crazy. We give them resistance training. They have a choice to do the things that we ask them to do. And if they choose to accept this, they progress. They get stronger, they have more balance. They go from having trouble standing to being able to walk and to run, all through challenges. The answer to my question is perhaps to choose to accept the challenges of the unplanned. You, the DPT-14s, may have been the most challenged DPT students ever. And I say that with all sincerity. If you continue on, keep pressing forward, you can be better than you ever thought you could. Maybe perhaps even better than you had planned on being. It takes work, it takes perseverance, sometimes it takes trust and hope. It takes good attitude, takes flexibility, takes rolling with the punches, and it takes accepting the challenges. You've already shown you can do this, and I have no doubt that you will take what you learned both in class and in life and become even better, much like our patients. We purposefully add challenges and resistance because we know that those challenges and that resistance leads to better. So I ask you, who is better than the DPT-14s to understand this concept? No one is better. You have been through it. You are here today, and I'm confident you will be here tomorrow. The DPT-14s may be the most prepared to face the challenges of the future than any other DPT cohort ever. One might argue that you've had the worst possible journey through PT school. Or one might argue that because of this journey, you are more prepared for your patients and for your own personal challenges, for relationships, for having children, etc., and etc. I would argue both. What is not up to debate is you made it this far. You still have a lot to go. but you've learned from the resistance training you've received, not necessarily through planned experiences, but sometimes, nor by choosing, but you struggled, and through those struggles, you've been determined to carry on, and you've made it through the manner in which you have, and that's an inspiration to all of us. Just this morning, for example, I walked past your classroom. I did not see any smiles. And that's because you were wearing masks. Thank you. I did, however, see smiling eyes, even through all the turmoil. People were smiling. You were having a good time. You are rock stars. You are pioneers. You are mavericks. You are survivors. You are doctors of PT, almost. Still a little ways to go. So what is your plan for the unplanned? Hopefully it will be that you continue handling the unforeseen, the unplanned, the unchosen, as you have been doing, by accepting the challenges with grace and smiling eyes, because you are great people and you're on your way to be great therapists. Thank you.
Thank you, Dr. Wilkinson. I always appreciate the opportunity to listen to Dr. Wilkinson speak. Thank you, DPT 14s, for this honor of getting to address you today, and I want to extend my welcome to your family and friends who are with us online as well. I just love you guys. You're a great class. I have been looking forward to being here with you for a long time, and talking a little bit about the symbolism of the white coat, what it means to me and to others who wear it or figuratively wear it. And I have to apologize to this side of the room. I'm suffering from a little bit of left-sided neglect, I guess, because we don't have a screen for you over here. We do have one for this side of the room. So if you crane your neck and try to see the screen and get a cervical spine injury, we've got a lot of orthopedic PTs here. We should be able to take care of that. So I'm here to talk about the white coat and its symbolism. But in full disclosure, I have to tell you that in my career as a PT, I've never worn a white coat to work. I know some have, but I have not. I've worn a lot of other things. I wore a camouflage battle dress uniform in the Air Force. I wore scrubs, which is probably my favorite work uniform. I've even worn gym clothes a time or two, business casual, business attire, but never a white coat. But I don't think it's important what we wear to work, but it is important when we think about the symbolism of the white coat and what it means to us as healthcare professionals. Even as physicians, there's a lot of controversy on whether the white coat should actually be worn. They talk about the spread of germs and the psychological barrier it can create between patient and physician, but then they also talk about the symbolism of purity in practice that it symbolizes, and the benefit that has in helping patients see that they can trust their physician. So there's lots of controversy there. So I'm not here to talk about what we wear. I'm here to talk about maybe figuratively putting on the white coat. You'll do that physically here in just a little bit. But figuratively, what does it mean to us to put on a white coat? So the physicians in the late 1800s, up to the late 1800s, wore black. You can see this in Thomas Eakins' painting in 1875. There may have been many reasons for this. Some might be it was just a symbol of the solemn nature of their visit. They were often called in as a last resort at this time in our history. So their visit often was a precursor to death. The medical profession had not progressed or advanced enough to treat disease successfully, so it wasn't a great thing when the physicians showed up. But then in the late 1800s, biological scientists who incidentally wore white lab coats discovered bacteria and discovered effective ways of fighting bacteria. And this was something that physicians realized would elevate their practice, and they embraced it. They also embraced the white coat as a symbolism of cleanliness and purity in practice. And this same artist painted another, whoa, well, a little sneak preview there, painted a picture of physicians in white. And this was just 14 years after his previous painting. So this shows that shift in how the public viewed the physician in white. Well, I blew that one. So this is how PTs might be depicted later in artwork in our era. You may recognize a few of these future PTs. So today, the white coat is not only a symbol of the physician, but a symbol of many healthcare professionals. And it symbolizes the rigor of medical training and also the trustworthiness of the practitioner who completed that training. So what should it symbolize to those of us who wear it? It can certainly symbolize a lot of things to a lot of people, but since I'm here speaking, I guess I get to talk about what it symbolizes to me. And I've titled the rest of my remarks, Finding Balance, because I think that depicts really what the white coat symbolizes. What I mean by that is that every personal trait we have can be an asset or a liability depending on how we cultivate it and use it. So let me share some examples to illustrate this. First, I'd like to take a look at the trait of empathy. Kind of the opposite of empathy is insensitivity. And when I thought about this and finding balance, I realized that as physical therapists, we have to have a measure of both. So let me tell a couple of stories to illustrate what I mean. My first story is about Justin, who was a patient of mine. That was not his real name. He was struck by an out-of-control vehicle on the freeway while he was working on a road crew. He had bilateral femoral fractures, multiple pelvic fractures that were unstable, multiple lumbar vertebral fractures, mild traumatic brain injury, among other. And poor guy was a mess. It was a bad day for him. When I met him, he was in the ICU and he was confined to bed for 10 weeks. Was not allowed to get upright for 10 weeks. I felt great empathy for Justin. Every time I went into his room, my heart just ached for him. And I was there to initially just to provide passive range of motion, and I feel like I was there to provide some mental therapy as well. We became fast friends, and I found it very easy to be empathetic to Justin. There were days that I'd go in and he just didn't want to do it, and I totally got it. I understood why he would not want to do therapy with me. I mean, I wouldn't either. But I also knew that I left him there to not do therapy. His misery that he was currently in would be prolonged. I knew that he would stay where he was and not progress. So there were days when I feel like I had to suppress my empathy and become a little bit insensitive to be able to push him to do the things that I knew he needed to do so that he could progress and reach his goals. And that's a tough balance, especially if you're an empathetic person. It's tough to push yourself to the other side of that scale. But it's important as a physical therapist to be able to do that. Now I'm going to do the flip side. So this next patient, Maxine, came to see me in the outpatient clinic, and she wanted help with her chronic neck and shoulder pain. To be brutally honest, Maxine was not a very likable person. She was very negative, verbally abusive at times, cranky, manipulative. You name the adjective, she kind of had it. My coworkers watched me go through the initial consult, and I could see some of them shaking their heads, and they were empathetic to me. But I found myself, I realized my insensitive side was kind of close to the surface. So the more verbal abuse I took, the more I just wanted to retaliate, and the more frustrated I became. And I realized, though, that my empathetic side was telling me, you need to find some empathy here. You need to be a professional. And thankfully, I was able to listen to my empathetic side, and I thought, well, maybe if I try to put myself in her shoes and see things from her perspective. So I tried to look at the world through her lens of chronic pain. And that simple exercise kind of changed my life, changed my philosophy, and my view of my patients that have chronic pain. I soon found that I could find rational reasons for her behaviors. Not that I agreed with the behaviors, but I could see why. And I started to understand that her lashing out was just because she was afraid that she'd never get better, and it was a cry for help. This understanding made it a little easier for me to absorb the verbal abuse and not want to retaliate, and helped me understand her a little bit better. I saw Maxine for at least, I think it was 2.5, 3 months, and by the time that she was discharged, we were good friends. My coworkers mentioned to me after she was discharged that they had not seen much change in her behaviors, but to me, she seemed like a different person than the one I'd met initially. In this case, I had to push my scale towards empathy from insensitivity. So, depending on the situation, the balance might have to shift one way or the other. So that's empathy. Now I'd like to talk about balance between humility and confidence. These two traits are so closely linked that it's sometimes hard to tell them apart. In fact, I think they might be inseparable. And I think we need both to be successful clinicians. For example, I think that healthy humility manifests itself as quiet confidence, as being comfortable enough with your own skills and knowledge that you are okay with admitting when you don't know something. Similarly, I think confidence and humility exist together when we have the self-assurance to take accountability for our mistakes, but not let them define us. And as a final example, to show balance between confidence and humility, I think we can do so when we confidently share our own views while being open-minded to the experiences and ideas of others, regardless of their station in life. So there are a lot of examples of that balance between humility and confidence. I've seen a lot of examples of this balance in your class. When I look at all of you, the DPT 14 class, I see a lot of great young professionals who have already achieved great things, like academically, personally, professionally, athletically. And yet, you have shown great humility in your openness to feedback, your eagerness to learn, and your resilience in learning from challenges. I think Dr. Wilkinson really covered that well. I think you are well prepared for the challenges that you'll face as clinicians. So I believe you already know how to balance confidence and humility in your practice, but I encourage you to remember how critical these traits will be to you as you gain experience and become seasoned clinicians. Let me just share a few ideas of how you can strike this balance in your future practice by basically doing what you've been doing already here in school, just like I've observed. One, don't let your future success dull your openness to feedback. Rather, seek feedback at every opportunity. from your clinical instructors over the next few months and from your peers after graduation. 2, just like you've done here in school, always be eager to learn. In other words, don't be so confident in your knowledge that you don't think you need to learn anymore. So keep acquiring new knowledge by attending continuing education courses, reading and applying current literature to your practice, and watching and learning from other practitioners. It's fun, and it will make your practice better and more fulfilling. And 3rd, show resilience by learning from challenges. You'll certainly have challenging experiences as PTs, but these challenges can take on many forms, such as problems that you can't solve, patients that aren't getting better, work environments that are less than ideal. Like we've talked about already, you're well equipped to handle these challenges. Don't let any of these challenging experiences erode your confidence. Instead, see them as opportunities for growth, and you'll emerge from them stronger clinicians and better people. One last example of finding balance in practice is the balance between serving others and serving yourself. Had to get the Star Wars reference in there. I think this is probably, of the 3 that I'm talking about, one of the most difficult to achieve a balance in because it's so situationally dependent. Here are just a couple of examples of how this could play out in clinical practice. You have to make your patient comfortable, or you have to choose good body mechanics. And you can't do both. Another one, spending extra time with that last patient even though you have plans right after work. So that's just 2 examples. I could go on, but I don't want to take up too much time. I will say that some days the family dinner that you needed to get to might be more important than staying late at work. Other days, it might be more important to stay at work and help that patient. It's going to be up to you, your clinical judgment, your personal judgment, to decide what needs to happen. My only advice to you, because I don't have any great answers on this one, it really is a challenge. But you'll be practicing as a physical therapist for many years, and you'll fill that role best when you're taking care of yourself and your loved ones. The occasional sacrifice of personal time or comfort will certainly be necessary at times, but if you always choose that side of the scale, your personal life will eventually suffer and you could experience burnout, and we don't want that. So this isn't good for you or your patients. So each time you're faced with these types of choices, just ask yourself, can I afford this personally? If the answer is yes, then great, choose the work side. If the answer is no, I really need to do this, choose the personal side. And if you're ever going to err on that side. Take care of yourselves. We want you to be happy, fulfilled, practicing clinicians many years from now. Okay, one final story that I'd like to share about to illustrate the balance between self-care and serving others is about my friend Alex. He graduated a year before me in PT school and started working at a local clinic. Shortly after graduating, he was diagnosed with ALS, or Lou Gehrig's disease. And within a year, he was struggling to walk, and he was already losing his fine motor skills, so it was progressing quickly. Yet, in spite of his challenges that he was facing personally, he kept working and trying his best to help his patients. And his colleagues helped him by adjusting the caseload and the schedule to accommodate his physical abilities. Alex was humble enough to accept help when it was needed, but he was also confident enough to provide treatment when he could and do it in the way that he could. If there was a manual treatment that he couldn't perform, then one of his colleagues would step in and he'd take over their patient for a little bit. It was it was a neat thing to watch, the give and take in the clinic as they took care of Alex. But it wasn't a one-way thing. Alex smiled at everybody. He made everybody feel needed and important in the clinic, and he provided good care. So there was give and take on both sides, and I'm just so grateful for the amazing example that Alex and his coworkers set for me of how to balance taking care of yourself and taking care of others. So, as you embark on your full-time clinic learning, how will you find balance and purity in your practice? How will you achieve the balance between empathy and insensitivity? How will you balance humility and confidence? How will you balance selflessness and self-care? I hope my comments today have stimulated some ideas for you as you don the white coat and start trying to live up to its symbolism and purity in practice. I know you guys are going to be amazing. I feel like I was preaching to the choir today. You guys know how to balance things, and you've proven that over the past 2 years. I'm excited to hear about your successes, your challenges, your triumphs, and all your experiences over the next 9 months, is it? Something like that. You're going to be wonderful. Congratulations.
Can't put me after Dr. Purcell, man. It's terrible. No. I've titled my remarks, "Anybody who elected me can meet me by the flagpole after the ceremony." No, I'm grateful for the opportunity I get to speak, and I'm sorry that you guys have to hear me more, because I know you're probably sick of me. So when I was asked by Dr. Cece to speak at the event, a scene from my favorite movie came into my head. So the Roman general Maximus is preparing for battle, or he just gets done with battle, I'm sorry. And Marcus Aurelius, the emperor at the time, comes up and asks him if he will reign in his stead after Marcus decides to give up the throne, essentially. And Marcus says, "Will you accept this great honor which I have bestowed upon you?" And Maximus goes, "With all my heart, no." And Marcus says, "That is why it must be you," right? And that was me. Dr. Cece's like, "Hey, they liked you to speak." I was like, "Yeah, no thanks." No, but here we are. So nothing I could do. But the phrase "that is why it must be you" has stuck in my head for a long time, ever since I first watched the movie. Right? Here's Maximus. He wants no part of what's going to happen, but solely because of that fact, because of his humility, like Dr. Purcell talked about, that's why it had to be him. I think if you would have asked us 2 years ago at this point, if we would have wanted to do PT school online, deal with shutdowns, overcome any of the other crap that we've had to overcome in the past 20 months, I think we'd all say, with all my heart, no, right? But here we are, and that's why it had to be us. I don't think anybody else could have done it. I won't prattle on with motivational quotes or anecdotes. I'm not going to bore you to death reciting the first 5 things I found on Google after why we have white coat ceremonies. Or, sorry, Dr. Garg, when I looked on PubMed for white coat plus DPT and ceremony, right? But I will say this. So when we leave here, got our white coats on, pictures are taken, the posts are made and tagged and liked, all that good stuff. It's not about us anymore, right? School was about us. It's our learning, and we're here for the experience, and we're doing this. But I think as soon as we step out those doors, it's not about us anymore. It's about the people that we vowed to serve when we decided to embark on this path. And I think if you ask anyone, most of us would have said that the whole reason we came to PT school was to help other people, right? Some people might have said I did it for the money, and those people are crazy. But most of us want to serve in our communities and improve people's lives. And so after tonight, that's the expectation. Serve in the community, improve people's lives, including our own, including our families, right? Once we leave, nobody cares about A's anymore. Nobody should have cared about them anyway. I still got A's, don't worry. Nobody cares how you did on your practicals, because obviously we've passed them all to get to this point. And, nobody cares if your mom thinks you're the best PT in the world. My mom, she doesn't know me yet. No, I'm kidding. But what matters is how we put our skills to use. And it's time to go to work. It's time to get in the trenches. It's time to do the damn thing, right? Excuse me. Pardon my French. You know, we've learned a lot in the last time that we spent together. We've learned a plethora of tests and measures and diagnoses. Learned how to deal with people from all walks of life, all manner of experience. We've learned how much those people can get under our skin at times, right? We learned how to adapt, overcome adversity. We've learned the value of teamwork and cooperation. We learned how to listen to, question, and apply the things that we've been taught. And if learning those hasn't given you the confidence to be a good PT, I don't know what will. I think we can all leave here tonight and really know that we've been prepared, we've been put on the path, and we're ready to go, right? And at the end of the day, you know, we make a big deal about these white coats, right? But we got to remember what they are. They're a symbol. Seneca, the philosopher, said, "It's a rough road that leads to the heights of greatness." We've all traveled a rough road to get to this point, right? We had undergrad, GRE, interviews, classes, tests, practicals, all that stuff. Life is rough. We all go through trials. We got kids, deaths in the family, mental illnesses, stress, you know, a number of things. And the road only gets rougher from here, right? The stakes only get higher. The pressure builds. But the great American poet Tupac Shakur said, "Always do your best and don't let the pressure make you panic." And so we can move forward with confidence. Can't let the pressure bring us down. These white coats are a symbol of how far we've come and how far we have yet to go, but really that we've been prepared and we're ready to stay on that path until we reach greatness. On behalf of the cohort, I'd like to thank each member of the DPT faculty. It really has been an honor to learn and work with you the last almost 2 years. I hope that we have all earned your respect or will earn your respect at some point. And I hope we can be called your peers because, you know, you're a pretty good peer group to have. On behalf of the cohort, I'd also like to thank every family member and friend and mentor who's watching virtually that has helped us get to this point. I know we all have family that we've relied on, friends, people that we can call in hard times, so make sure you thank them when you can. And finally, I'd like to personally thank each member of this cohort. We're good. You guys have had a profound impact on my life, every single one of you. And I don't say that lightly, and I mean that with all my heart. I love all you guys, and I'm so glad that we got to go on this journey together. And I hope that we can all leave here with the knowledge that we're on the road to excellence. Thank you.
Thank you, Drs. Wilkinson and Purcell, and soon to be Dr. Motley. We will now move forward with a presentation of the white coats. Dr. Wilkinson, if you would take your place, front and center, or to my left, rather. And then we'll begin by faculty advisors. So Dr. Ann Hoffman, if you would come forward. And I think to make this workable, let's hold our applause until after the faculty advisor has presented the white coats for the 2, 3, or 4 that faculty advisor will be providing those coats to. First, we have Mia Dulud. Chandler Rudolph. Megan Miyawaki. Kishan Patel. Now we should clap double hard for both groups. And thank you, Dr. Young. Dr. Clausen will present to Kevin Baldwin. Caden Craig. Abby Vance. Dr. Dana Tischler will present white coats too. Thank you. Joshua Hunt. And Rachel Mejia Hernandez. Because I pronounced it right? Okay, good.
And now Dr. Paulson will present Colton Gray. Austin Judkins. And Nick Montague.
Dr. Hina Garg will present to Garrett Jones. Dr. Joel Tembrink will present the white coat to Jillian Brown. To Braden Lee. And to Kyle Reynolds. Dr. Jonathan Wright will present the white coat to Blake DeVries. And to Danny Foster. Dr. Paul Stoneman will present in place of Dr. Kaivi Chung Hoon, who was not able to be here tonight. First to Rachel Christensen. And also to Zane Ventimiglia. Dr. Kelsey Kishlin will present to McKay Fristrup. And Dr. Mark Walker will present the white coat to Andrew Finlinson. Followed by Bogan Fran. Dr. Megan Pratt will present the white coat to Mason Orton. Oh, camera time first. And Dr. Michael Bartholomew will present white coats to Mitch Belliston. Logan Parker. Luke Plazier. To Braden Wilson. and also to Nathan Knorr. Dr. Miriam Cortez Cooper will present to Dr., or soon to be, Dr. Brady, Jared Brady. To Dorian Singh. And to Jordan Tanner. And I just want to say, Dr. Cece, please stand up. That's when she needs to say, I am standing. That was the only joke I had for tonight. And Dr. Misty Timpson will present to Grant Walker. Once again, Dr. Stoneman will present to Kyle Bates. To Davis Borg. And Trevor Lowe. And Dr. Rodri Purcell will present to his advisees, Rhett Almond. And to Amelia Fulmer. And Dr. Purcell will remain up front while he assists Dr. Wilkinson in presenting to his advisees. First, Nick Arbin. Michael Potter. and to Ben Wallace. Dr. Tim Stevenson will help present to Roston Grady. Grandy, yes, I misread that. And to Donald Sharp III. Lastly, Dr. Will Sykes will help present to Sam McKay. To Terrence Motley. And to Justin Walker. Congratulations. We do wish to acknowledge those three of the cohort who weren't able to be here tonight for a variety of reasons, and we miss you very much. Kayla Gallegos, Josh Nelson, and Cameron Keys. We hope you're doing well. At this point, we will invite Dr. Megan Pratt to lead the cohort in their oath, and then I have a few concluding remarks, and I will keep them few.
All right, they gave me the easy part, so you guys all have the oath written, but I feel like it's more official if you stand up. So go ahead and stand up, and you guys at home stand up as well. All right, you guys ready? Repeat after me. I pledge to hold faithful, to my future responsibility, as a physical therapist. To use the highest science, and skill of my profession, at all times. To refrain from treatment, when it will not benefit the patient. To exercise all aspects, of my calling, with dignity and honor. I commit myself to the highest ideal of service, learning, and the pursuit of knowledge. These things I do swear. Great job. You can have a seat.
So if you can forgive me for just a minute, I'm going to get ready for work. Okay. Okay, I've got them all, right? These are some of my tools. This is the tool I always want you to have. This is the one I received when I was in physical therapy school. It's still hanging on. It holds together. It says 4D. My course director used to call me 4D. His name is Dave Greathouse, and he's one of those people that we look to as a leader in the field of physical therapy. I remember him with fondness. I also have my goniometer that if I had the same eyes that you guys have, I could make out Second Lieutenant F.D. Paulson. It's still in my pocket. This is probably the most important tool I use to take notes, to make sure I don't forget anything as I then transfer that to an electronic medical record. We used to write it all out, right? These keep my ears fresh. These make, oh, where's this? Okay, this one I put on fingers so I can tell when they're doing high intensity interval training, right? Or not, depending on what that patient might need. My love for this profession is profound. But I want to just share these words with you. I love you. You're great people. And because of that, I thought of 5 other tools that I think are valuable to have. They've been touched on today, and I'll just refresh your memories of those thoughts. Integrity. Hold true to your values. And in some cases, say what you'll do and do what you say. That's post-it note number 1. Post-it note number 2, compassion. In order to have compassion, I just wrote down a couple of things. Have patience, give service, show love, kindness, and friendship. Have a great attitude. That's all. Just have a great attitude. Take a sense of ownership. When I did a lot of hiring, and trust me, I did a lot of hiring, one of the things that I would watch for is someone taking ownership of their place. And one of the best ways is to recognize that someone takes ownership in where they work or where they serve. They pick up the garbage. If you see a piece of garbage, pick it up. That means you own that place and you care about it. And you care about the things that go on. And then lastly, learn something every day. And because you want to help others learn something every day, teach something every day. That will be important as you continue on in your role as a physical therapist. Right now you're a student, but this morning I saw a former student from Rocky Mountain University filling in for a physical therapist, and she has a license. You'll be there soon, and it'll be that opportunity to change gears, not have to wait for someone else to co-sign, and do the work on your own. I'm so excited for you, for what you'll learn, and for what you'll do. I look forward to great things. We want to just thank all those who have participated physically today in this activity, this event. I want to make sure that the technical staff and those who are behind the scenes, whose names, if I mentioned, would certainly sidestep any gratitude that we might give them, but let's give them a warm round of applause. And thank you to friends, family, and others who are watching these proceedings tonight. It's an honor to be a part of this team that you are a part of in so many ways. Thank you for your attendance, for your tuning in tonight, and with your approval, Dr. Wilkinson, thank you. Have a great night. There are refreshments.